I'm going to introduce Dr. Kenney to talk a little bit about behavioral health. So Dr. Kenney, the floor is yours.
All right. Thank you so much. Well, thank you, Dr. Bianchi. And so good to see all of you joining us to have these conversations about the different specializations. So thank you very much for inviting me. So I'm going to talk to you about the behavioral health specialization, which is primarily where I teach. And just a little bit about me. So after I got my MSW, I had about 8 years of clinical work and primarily working with men and women who were struggling with substance abuse, mental health. And my primary focus has been working with folks who are just as involved, specifically women who were struggling with drug and alcohol, substance abuse, and also trauma. And so a lot of my work has been in those areas. And that's sort of where I draw a lot of my stories, a lot of my cases, anything that comes up in those classes. So that's sort of a little bit about me. And I'm happy to share more of that if you were to email me or if you were to join the specialization. I am going to put my email in the chat real quick, and then I can start talking about the behavioral health. I just want to give you a little bit of an overview of who I am. All right. So basically, when folks usually think about social workers, they usually, and at least my perspective, I don't know if Dr. Nyland and Dr. Rita will disagree, but I think we usually think about behavioral health. We think about that historically, we think about that practically, we think about sort of the overarching working with lots of systems. We think about the kinds of things that you will learn in this class as far as accreditation, being in compliance with CSWE, being in compliance with NASW. Also, with the current market demands, there is a huge market demand for social workers across the board, but especially for folks who are familiar with behavioral health. And then also when we factor in new policies related to insurance coverage, getting reimbursed, having that behavioral health background is really going to serve you well in those areas. And when I think about behavioral health, I think about sort of the really holistic social work practice. So we talk about biology, we talk about the brain and neuroplasticity, we talk about psychological components, we talk a lot about social areas. We know that primarily a lot of positive work gets done when there's a good relationship between the clinician and the client, patient, consumer, no matter what evidence-based intervention you use. So we do talk a lot about that. And then also, how do we help people involve themselves in more positive pro-social activities outside of the session, outside of the treatment area. We also can talk about a lot about economics, financial stability, et cetera. What's going on politically? There's a lot of talk about policy, what kind of policies might be affecting the interventions that you're able to provide, what kind of policies are impacting the insurance reimbursement for the interventions that you may want to provide. And then also sort of behavioral health, the behavior part of behavioral health. We really are about doing really holistic, comprehensive biopsychosocial spiritual assessments, as with every social work assessment, that is done. And we also really focus on how do we change behaviors so that folks can live lives where they feel more fulfilled, where they feel healthier, and also where they don't need us anymore. That's really the overall the overall goal for all social workers. When we think about sort of being a social worker, being a behavioral health focused social worker, I think of that being clinical, and clinical is sort of the way that I think about it is sort of a cap. It's a way that I might think about how I might perceive the world around me, the lens and through which I might look through things. Will you click a couple times so we can see the whole thing? Yeah. So when when I think of a cap, I'm thinking sort of like a baseball cap. And so when we think about, I don't, when I'm in session, when I'm in group, when I'm at work, I am thinking, I'm assessing, I'm reassessing, I am talking to my supervisors, I'm talking to my peers, I'm talking to colleagues, and I'm also critically analyzing, what is happening in the treatment room, what has maybe happened with this person in the past. And that cap really helps me think about things differently and see that person more holistically so that I can really provide them better services. we really don't want to be thinking about doing, only direct interpersonal psychotherapy with behavioral health. There is micro, meso, and macro behavioral health. And so internships that my students are in right now, they span the gamut from people who are doing individual therapy all the way to someone who is primarily in a research/policy placement, which they're actually having a fantastic time in, which is kind of really nice to hear folks sort of talking about doing that level of work. It's not about just individuals. It is about group work. It is about, sort of thinking about those larger macro issues. And unfortunately, sometimes behavioral health gets pitted against research, gets pitted against policy. And the way that I perceive it is that you have to have it all. It really all comes together in behavioral health. If you aren't thinking about policy, if you aren't thinking about people more holistically, you're not going to really be able to do the best job that you can as a social worker. All right. So when we think about, clinical social work, we do think about practice with clients and systems. We look at problems, we look at maladaptive behavior, we look at historically psychological issues, social networks, what kind of networks and resources folks have, and then the roles that we take on. In therapy, we're case managers, we're therapists, folks go on to be managers and supervisors, potentially executive directors, clinical directors. We function using different kinds of therapies, doing differential diagnoses. I also teach the DSM class. It's an elective usually in the spring. And so that fits really nicely with some of the other things that I do. The ability to collaborate and consult with others is also something that we take into account. The settings that you will be able to work at: outpatient, inpatient, medical hospitals, hospice, private practice, shelters, etc. And then also the idea is to train you to eventually get your LCSW. Not everyone who takes behavioral health specialization is going to be going after their license. However, you will be prepared and you will have an idea of what it takes to get that license. So the focus of behavioral specialization is really to prepare scholar, practitioner, activists who understand mental health, who understand how people fit into the systems, into the communities in their lives. And really, it's not just about direct practice. It's about, working with the person in front of you, maybe bringing in their family, maybe having other conversations with caregivers or whatnot, but really seeing people more holistically. Also, we think about in order to do this, we talk about how to conduct complex biopsychosocial spiritual assessments, doing psychodiagnosing, looking at cases, looking at treatment plans, looking at different evidence-based interventions, working with teams, looking across the continuum of community mental health care, and then also always thinking about how does this fit with our code of ethics and how does it also fit with the related mental health laws. So in behavioral health specialization, you will learn a ton of clinical treatments and therapies and strategies from systems, neurobiology, psychoanalysis, cognitive behavioral, trauma-informed, etc. Yeah. One of the areas that I'm really focused on, can you go back?
Sorry.
One of the areas that I really focus on is trauma-informed care. And so we will be talking about all the different types of evidence-based trauma-informed care. And one of the things I do particularly focus in on is somatic trauma-informed care. And this doesn't mean I'm asking you to ever touch another person, put your hands on another person. That's not what we do. That's not physical therapy. We're not massage therapists. However, there are a lot of things that you can do to help people release the trauma that's actually in their body. A lot of people who have experienced trauma sort of live from the neck up, and they forget they have a rest of their body. And we know that trauma lives in the body. And one of the ways in which we help folks heal is we help them get in touch with that trauma. And again, I do want to say, to heal from trauma, no one has to ever tell their trauma story. And however, there are ways to help move that trauma through the body so that folks can actually feel some relief and feel a lot better. Again, practice strategies going on to assessments and whatnot, and all sorts of things, all the way through to case management, cognitive behavioral therapy, motivational interviewing, forensics, etc. All right. And then with your behavioral specialization, here you'll have these slides. There's a whole list here, and I don't want to go through all of them, but, state and forensic hospitals, prisons, which is a place where I worked for many years, jails, hospitals, etc. And then also the typical clients and populations and clinical issues that you'll work with. Folks with severe and persistent mental illness, personality disorders, disability, substance use, involuntary settings, etc. And last but not least, I do want to let you know that we have created a new elective that I'll be teaching in the spring called Forensic Social Work with Adults. And so if you are interested in learning more about that, it's sort of how adults move through the system, and then also how families and communities are affected by the criminal legal system. And so that's going to be available in the spring, which I'm very, very excited about. But that's all I have.
Awesome.
And I'm happy to answer questions right now, or I'm also happy to meet with folks or answer over things through email.
This is great. Thank you, Dr. Kenney. Anybody have any questions or comments? A few moments earlier, I asked Dr. Reed if behavior or medical social work is kind of a growing field. I imagine behavioral health is also a growing field, as is children and family, but I imagine there's a lot of funding coming down the stream from the state to have more folks doing behavioral health.
Yeah, there's definitely a workforce need for folks who specialize in behavioral health. There's a question: if our theory course conflicts with the forensic class, can we switch out of theory? I don't think so. The theory is a required class, correct?
It is. If they want to switch out of that section, if they talk to me about it, I'd be open to it.
Okay, fantastic. Fantastic.
I have a question.
Yeah.
Yep.
So you mentioned earlier that this field is a lot based on psychotherapy, but in setting like the jail and prison, how would you go about doing so? Doing psychotherapy when there's a lot of like safety issues and limited time?
Well, it depends on the prison and the jail where you would be placed. I have worked in men's maximum security prisons. In the men's maximum security prison, one of the ones that I worked on the mental health unit. And so I did do biopsychosocial assessments with men who were actually involuntarily committed. If you can imagine, they were been arrested, incarcerated, and then they were involuntarily committed to the mental health unit where I worked. So that was something that I did for a while. I also provided a lot of biopsychosocial education to women in a jail in Cuyahoga County. And then also did some assessments, which then were sort of forwarded on to probation officers after they left. So there's a lot of different things that you can do. It's being in a jail and a prison is not considered a typical placement per se. Usually your clients don't come to your office. Usually you go to their cell, or they are all brought in a group to a room, when there's a correctional officer there. And part of what we do talk about is, how do you form relationships with people who are incarcerated, and also form relationships with the correctional officers who may not be so nice to you or to the inmates? So there's a lot to talk about there.
And this is exactly why we have this new elective, because, I teach sometimes the behavioral health policy class, and, we talk there, unfortunately, that sad reality that our criminal justice system is becoming our mental health system. And that many folks who are incarcerated have severe mental health needs. And so social workers are working both at the macro and micro level on challenging that.
Yeah. And also in this class, we will be talking about abolition. We will be talking about restorative justice. We will be talking about, how do you make it through in a place that does not, jails and prisons that do not share the same values and ethics that we as a field, or live by. And it can be quite challenging. However, like Dr. Biaki just said, a lot of times the folks who end up in prisons and jails are the folks who have fallen through every single other crack, whether it be, homelessness, severe persistent mental illness, health issues, disability, etc. And so it's imperative that we have more social workers in jails and prisons, for sure.
Yeah, definitely. Like the pending list for a state hospital is super long.
Yeah. But they're building prisons. Yeah. In fact, right now there's a jail expansion. They want to expand the Sacramento County Jail and have a mental health jail. What does that even mean? Right? We already have a mental health jail. It's called jail, right? Like that's where folks end up going. So if these issues get you as fired up as they do me, and I have said many times, one of the reasons why I don't go to jail is because I decided to be a social worker and do something about these things, because I do get so fired up. please, consider joining this elective, because there'll be some lots of conversations, and I have a lot of experience that I can't wait to share with all of you.
And I hope that listening through all these specializations from Dr. Reed's presentation, Dr. Nyland's presentation, and now Dr. Kenney's presentation, you appreciate this theme of social justice and dealing with inequities as not as just a contextual issue, but as a core issue of practice. And that social workers, even if we're doing behavioral health, are thinking both what's going on politically, what's going on in the community, and what's going on within an institution as part of what social work is. So I really enjoyed hearing all three of our colleagues talk about what they do and how much passion they get to it. And I hope as students, even if you don't go into that specialization, you kind of learned a little bit more about how social workers are thinking about these very issues. So thank you so much, Dr. Kenney. She put her email on the chat. She has this exact flyer. We're also going to include it with our email later